I talk about the role of sports on diabetes care and treatment. Then we remember you that diabetes mellitus is a common disease of our population, and it is characterized by a series of changes due to a relative or absolute deficiency of insulin, which affects about 115 million people worldwide. And we know that we have two forms of diabetes, diabetes 1, type 1, that is common on child and in young people, and type 2 diabetes that is common in the age about 15 and 16 people. But the sports and physical activities for the illness of the people is most important, and in some cases we know that the only therapy that the patients used for the reduce of glycemic profile is sports. But for synergy of action of insulin and muscle work, exercise has long been considered a pillar of diabetes therapy, and exercise is an integral part of the diabetes treatment. But for the first diabetes of the form of child, insulin-dependent diabetes, sporting activity increases insulin sensitivity and reduces requirement. Reduce the upward trend of typical diabetic weight because the typical patients with diabetes 1 is obese, and most important in these patients the sports and aerobic sports. Increases the maximum capacity for season consumption and improves the lipid profile with the aumento of HDL and triglyceride. The major risk of these people with diabetes 1 is the hypoglycemic episode, determined from the exercise, and then immediately stop exercising in progress, take fast-acting carbohydrates, make a snack of a complex of carbohydrates, as crackers or biscuits or fruit juice, and then rest 50 minutes and wait for the carbohydrate from being absorbed. In the common form of diabetes, the type 2 diabetes, exercise is important because it enhances the trophism of the musculoskeletal tissue responsible for insulin sensitivity. And this typical exercise reduces cardiovascular risk, metabolic risk, kidney risk, and musculoskeletal risk. The benefits of physical activity in the prevention of type 2 diabetes are imputable because 25% of its incidence is due to the sedentary lifestyle. And then all studies indicate a marked reduction in the incidence of type 2 diabetes determined from the sport. The combination of aerobic exercise and a low-fat diet and high in complex carbohydrates content is desirable in the prevention and treatment of type 2 diabetes. We imagine that a patient with type 2 diabetes is older patients, but is not common older patient because the patient is has an age about 15 years. Then in this case, we conceal to the patients and sports or walking or swimming, but the patient is sedentary and is most difficult to include these ideas for these patients. Is most facility take pills for the treatment. But when we have these patients, we examine all characteristics of these patients. A free list of free blood glucose profiles before and after the free meals. 1ANC, because it's the most important markers of diabetes, and cardiovascular risk with electrocardiographic and at rest, and in the cases of clinics and even minor ECG abnormalities. Microalbuminuria for kidney risk, and for the eyes, most common is retinopathy, diabetic retinopathy, and we had fundus for the evaluation of vascular vessel of the eyes. Then the clinical examination on the FIT for diabetic fetty that in elderly patients is most common, and ability to recognize hypoglycemia and tests of cardiovascular autonomic neuropathy. How is the physical activity randomized recommended for these typical patients? Aerobic sports, running, cycling, walking, gymnastics, swimming, cross-country skiing, canoeing dance, not recommended activities, combat sports, and for patients treated with hypoglycemic drugs, diving, sailing solo and sports in which hypoglycemia puts at their risk on own lives and others. And in conclusion, intensive intervention on lifestyle-based mixed physical exercise, prescribed and supervised, in addition to conventional treatment, in a dose-dependent manner improves glycemic control, cardiovascular risk, physical well-being of patients, and economic costs. Thank you for your attention.